All right, so in this diagram, this is a uterus. Right in front of that is the bladder, and right behind that is the rectum. So you're looking at this from a side view, and kind of if you cut up straight from between your legs. Okay, so when you're looking at this, I'm going to see if I can make it a bit bigger for you. Anteverted uterus is the most common position of a uterus, and you might sometimes have people who say, oh, I was told that my uterus is facing the wrong way or backwards. That often is referring to retroverted, and that's what that is. I don't know that that's actually the best description. That almost looks like midline. I almost would say that needs to be pushed back a little bit, but you can just see the different angles, okay? So these are normal. All of these things you're looking at on screen are normal. It used to be thought that retroversion and retroflexion was abnormal and related to things like endometriosis, and they can be if somebody has really severe adhesions, but we also know that it's kind of, I explain it to my patients who have a retroverted uterus or a retroflexed uterus, that it's kind of similar to being left or right-handed. It's way more common to be right-handed. It's way more common for your uterus to be anteverted, which is that first picture, but left-handedness and retroversion are also variants of normal. So having a retroverse and retroflexed uterus can also, or any uterine, like any degree between these, it's kind of a spectrum. If you look here at the cervix, so can y'all see the cervix right here? So as you move different places with that, then the cervix gets higher or lower, and it's also placed more to the back or front of the vagina. So see here, this is way further at the front of the vagina, and see here, it's way further at the back of the vagina. So whatever place that your uterus sits makes it easier or more difficult or more normal or less normal to get to your cervix. And there's a lot of other factors that go into that as well. And many things can, like if you have big fibroids that are changing where your uterus is, or you're very pregnant, or you know, lots of different body shapes and sizes can make it harder or easier to find the cervix. But that's what people mean when they are having trouble finding your cervix. And I oftentimes catch myself doing this as well, where I'll say like, oh, your cervix is really far to the front, or really high, or really, you know, off to the right side or something like that. And then I think, oh my God, I shouldn't have said that, because I'm commenting on it, you know, from my doctor brain of just like, I'm trying to explain to you why this is taking a little longer and I feel bad. And I just like, please tell me if I'm hurting you. But in the process of doing that, I've probably made you feel like this is abnormal or something's wrong with you, which is not the case. So then I try to explain it afterwards. But your mom goes to college for, does having a retroverted uterus or retroflexed uterus increase the chances of having back pain with menstrual cramps and labor? With menstrual cramps, absolutely. So most people who have a retroverted or retroflexed uterus will tell you that they have their menstrual cramps more significantly in the lower back. As far as pregnancy goes, no, because this corrects by the time that you are in labor. If you imagine, as a fetus grows and grows and grows in there, the uterus gets bigger and bigger. There's no retroversion or anteversion left, and there's no anteflexion or retroflexion left. It's just all generally in the same kind of position.